morning, Andy.
Good morning. You know, this reminds me of some of our leadership meetings at MaineHealth where everybody sits at the back of the room and nobody wants to sit up front. And sometimes there I'm a little more obnoxious and make people move, but we won't do that. We won't do that today.
No, but it's great. It's great to be here. Didn't our chairs held up well over the past 2 years, didn't they? I just wanted to say we had no idea who was coming out this morning, so thank you all for showing up and being part of this. It really is great to be back together. And special thank you to Ken Bell, who endured these past couple of years and is now packing the house here at the Portland House of Music. So while it's fun to be here for donuts, come at 9. And Andy, before we get started, I just want to offer a word of gratitude to you and everyone at MaineHealth for getting us back here together today.
Well,
it was
Lisa,
a tough slog.
That's our frontline care team who has, I just can't tell you how inspiring and heroic they have all been this past couple of years. It just gives me chills to think about their journey. They are tired, they're exhausted, but they keep doing what they're doing because of their devotion to their patients and the communities they serve, and it's just an honor to be a part of that team.
Yeah.
So we'll pass the thanks to them.
Yeah, well, thank you, and thank you to all of them.
Yeah.
22,000 strong.
20,000,
yeah, that's a lot of performance reviews for you to do.
It's a lot. Yes, it is.
Yeah. So before we dive into early Andy, the earlier Andy phases, I like to say. So you walk in on day one, the new guy, the head guy. What do you walk into at MaineHealth, and what's the status of the system 1 year later? Because what was your actual start date? Because it's almost your anniversary, or you passed your anniversary.
It was April 5th of last year. So the status of the health system was largely really good. MaineHealth is an impressive system. I had been at Centra about just about a year when I got the call about the MaineHealth opportunity, and and I'd gotten called about other opportunities too that wouldn't have ever interested me. But MaineHealth has such a reputation for high quality, reliability, and safety in our healthcare industry nationally that, well, sure, I'd have to at least throw my name in the hat. And so when I got here, I found that was largely true. The organization does deliver on quality, safety, and highly reliable care. But the team was, tired. They'd been through a lot already. They were exhausted, but still finding the strength and will to continue to try to battle a pandemic, do the things that were important to our team. A lot of people, when they said, boy, you took this job in the middle of a pandemic, well, the pandemic was everywhere, so it didn't matter where I was. We were going to be dealing with a pandemic. So quite honestly, that wasn't as much of a deciding factor for me. But I will say this, when I took the role at Centra, I walked into that day one. The organization had started to enact severe layoffs the day before I arrived, unbeknownst to me before my arrival. We're on the heels of a CEO turnover where there was a sex scandal involving my predecessor. The organization was hemorrhaging money. We literally couldn't get a single bill out the door. And within a matter of a month, we had 2 immediate jeopardies from Medicare saying that we may have to shut your primary hospital down. So it's all relative at the end of the day. So I felt like if we could get through that, and we did.
Yeah.
We made had a big turnaround at Centra. If we could do that in short order, then with the team, the people, the communities here in Maine and New Hampshire, then we can move mountains and do great things.
Wow, I didn't realize. No wonder you got here so quickly, my dear. So, all right, let's talk about early Andy then. So where did you grow up?
So I grew up in a little town called Louisville, North Carolina, which is just outside of Winston-Salem. Some of you may know it as the home of Wake Forest University. Some others may know it as the Camel City, the tobacco headquarters of the world, home of R.J. Reynolds for a number of years. And when we had busing growing up as a kid, and so for my middle school years, went into the inner city. And, it was hot in August and September and May in school, so the windows were open. We're right behind the tobacco factories, and so I'd go home at the end of the day just breathing that tobacco smell all day. I'd go home, I'd reek of tobacco. And it was just part of the community.
And would your mother say, like, Andy, have you been smoking again?
That's exactly right.
So what did you think you wanted to be when you were younger?
So I wanted to be an astronaut. I wanted to fly in space. I just couldn't imagine anything more cool than that. I thought that would be the greatest thing ever.
Yeah, because you did some internships at NASA,
Yeah.
right?
So I co-opted. So I'd go
Yeah.
to school for a semester, then I'd work for a semester, and I worked in Houston at the Johnson Space Center.
Yeah. Oh, so then will you tell us about what you studied undergrad, and then how you got into medical school, that path?
Yeah, so I studied, wanting to do something in the space program. I studied engineering in college. I was an electrical engineer in school. And got to NASA and had some incredible opportunities to really work both as a flight controller, mission control at a young age, and then also serve in the astronaut office, working as a systems engineer with the flight crews. And really continued to inspire my desire to want to pursue that, and really ultimately decided that I needed more education than just an undergraduate degree. So I began to look, this is back before the internet, so I'm looking at the graduate school catalogs in electrical engineering, and
How quaint.
I kept getting nauseated. It just wasn't setting my heart on fire. So I just happened to, I'm always inspired by these people who tell you these amazing stories about because of a loved one who had a health issue or because of a tremendous mentor, they were really inspired to go into medicine. And honestly, I met the NASA flight surgeons and I thought, man, these guys have a cool job. They get to fly in the back of jets, they wear flight suits to work, and they get professional pay. What's not to like about that? And so, without any understanding or appreciation for what I was about to undertake, I applied to medical school and got in. And so finished my college career in Maine, began medical school in August. But while my motivation for going to medical school may not have been as inspiring, the impact on me was, and began to realize just the awesome opportunities that exist in medicine. And while I still wanted to pursue becoming an astronaut, something that became derailed when I was ultimately diagnosed with asthma, I couldn't be more thrilled with the opportunity to really have an impact in people's lives. But before I forget young Andy, I'd be remiss in talking about probably the most profound impact, most important event that ever happened in my life. And they always say, worry about what happens on like a Wednesday when you don't know, that you don't see coming. And that happened to me as a child when I was 15 years old. And at the time, I sort of thought this was, if anything, sort of an annoying event. But at that time, this dopey girl moved in across the street from me who was 14. And about a year later, she just didn't seem quite so dopey anymore. And so we started dating, and we've been together ever since.
And she's here today.
She is here today.
Unbelievable.
Yeah, so she's up there always with me. And Courtney she's my life. We've been together now. We're celebrating, I guess, our 29th wedding anniversary next month. And have raised 3 amazing young women who fortunately have taken after their mother in absolutely, completely every way, which is wonderful. And that was really the most profound thing that happened to young Andy.
Wow. I thought you were going to say it was your newspaper route.
No, I mowed yards.
Okay.
And then I got a job one summer, not delivering newspapers. Unfortunately, I delivered furniture. And if there was ever any motivation to continue education, to avoid manual labor, I got that exposure pretty quickly.
There you go. So you, when you graduated from medical school, then you went into the Air Force and you were a flight surgeon.
I was,
so
yeah.
That seems very exciting.
It was very exciting, for sure. And so I had the opportunity to effectively serve as a family physician for pilots and their families. And because flying is such a specialized occupation, we had to make the decision around whether someone was fit to fly or not, which meant that we got to fly in the cockpit of whatever our squadron flew every month for at least 4 hours, and typically much more than that. And it also meant that we had to deploy with our pilots if there was ever a challenge. And so I remember becoming a flight surgeon, thinking about all the incredible things that we got to do. So there were radar stations in places like in Mueller, and these opportunities to travel through Asia, on routine missions, and I'd volunteered to serve in Antarctica for a couple of weeks. And then 2 weeks after, to the day that I became a flight surgeon, the date was September 11th, 2001, and the world changed. And so what I thought was going to be kind of an exciting and interesting journey turned out to be a really exciting and interesting journey as I went to war and helped clear and medically support individuals who were first in Afghanistan during Enduring Freedom, and then I had the opportunity to deploy on a couple of occasions overseas in support of Enduring Freedom. And got to see parts of the world like Uzbekistan and Tajikistan, and you learn pretty quickly that a really bad day in America is way better than a really good day in most parts of the world. And it really shaped my perspectives on a number of things, and it taught you pretty quickly that you got to make the most of what you got wherever you are and whatever circumstances bring, even if it's really hard. And it also taught me about the importance of really understanding your purpose in your role. And that was very profound for me.
Wow. So that is amazing, and I'm sure a perspective you consider every day here in Maine, for sure. So then you practiced medicine for many years as a family physician.
I did.
But you make the pivot to administration.
Yeah.
What drives that?
Well, so I don't know. So this was never the plan. I never envisioned being a CEO of an organization. And I love practicing medicine. I was never running from that. And in fact, had wanted to practice medicine here. But I realized that there were a lot of decisions being made that I think were well-intended, but had lots of downstream unintended consequences and impacted the ability of physicians like myself to effectively care for patients. And I was at an organization at the time that I think had an interest in hearing that perspective from physicians. And so I got invited to a meeting that I thought all of us were supposed to go to. Not many showed up. I did. I raised my hand, asked a few questions, got invited back to another meeting. And then that led to another meeting and then more meetings. And before long, can you spend a half a day helping us think through some of these things? And that turned into 2 half days a week and 2 days a week. And then suddenly I was at the point where I was sort of caught between both worlds, caring for a full panel of patients half time and then still trying to be involved in leadership. And it was really a gut-wrenching decision for me. And I remember attending a physician leadership course in Boston. And the instructor of the course pulled me aside one day and he said, "You got a really tough decision to make, don't you? You have to decide whether you're going to be an executive who went to medical school or you're going to have to decide if you're going to be a physician with a leadership role." And I said, "You're crazy. I can do both." And he's like, "You really can't. You're going to have to commit to one or the other." And I was just torn up by that decision. And my middle daughter, who was probably about 11 at the time, could see the tremendous angst this was giving me. And she came up to me one night, she said, "Dad, I think you can probably always be a family doctor, but I don't know that you're going to have another opportunity like this." And it was truly those words that pushed me over the edge into making that commitment that I'm going to now become an executive who happens to have gone to medical school as opposed to a physician with a leadership role. And I never really saw it as administration. I always saw it as leadership. And that's not to say that I ignored the reality that I needed some managerial skills and administrative skills, although I assure you my direct reports would disagree with that statement. But that's really what sort of inspired me to do that. Every day in my clinic, I could see 30, 35 patients and make a real impact. I began to see that through leadership, I could make an even broader impact. And through the mentoring of some really good individuals, began to understand that while practicing medicine is an incredibly noble art, leadership, if practiced well, can be equally. And leadership, if practiced poorly, can be dangerous. And so that's ultimately what convinced me to go into that. Now, I ask myself every day, am I creating as much value as a leader as I would if I was in a clinic seeing 30 patients a day? And if the answer to that question is ever no, then I'll go right back.
Mm-hmm. Does your daughter bring this up a lot? Be like, "Remember, Dad, I'm the one So, I know I'm your favorite, and
So, no, she brings up all the times I've ruined her life and made a bad decision and didn't get her what she wanted and all that stuff. She does that all the time.
that's great. So talk about coming to Maine. You talked a little bit about it, but so we reached out to you.
Yeah.
Yep.
So you did, and I had only been a CEO for a health system, a smaller health system in Virginia, for about a year. And what really inspired me to want to take that job was just recognizing some of the realities that I was seeing in healthcare. Despite increasing investment, increasing costs, outcomes just aren't keeping up. And we're not fundamentally becoming any healthier despite all that we're doing. And I remember early in my healthcare career, as I was juggling both being a physician and a leader, being in my clinic seeing patients one morning and just recognizing that despite our attempt to vaccinate everyone against the flu that year, lots of patients were getting sick with the flu. And I just remember driving to my administrative office thinking, this is horrible. We're having a bad flu season. And then getting into my office and looking at the P&L for the hospital and thinking, hot darn, this is awesome, we're having a bad flu season. And just realizing how perverse that is, but that's the environment we're in healthcare, and we've got to change that. And I remember being a part of a healthcare system, a good healthcare system that does good work, but realizing that in an incredibly competitive environment that I was in Charlotte, that woke up one day and realized that I had helped contribute to an incredible overinvestment in healthcare for precisely 2/3 of the community. And the 1/3 of the community that we had not invested in, as you can imagine, was by far and away the most vulnerable. And these are two not-for-profit healthcare systems competing that way for years. I just thought there had to be a better way. So what attracted me to Centra was the fact that it, for the most part, was the only healthcare system in its market. And I didn't look at that as an opportunity to say, well, that just makes the job easy. You don't have to worry about competition. It made me realize that there was an opportunity to say we can be responsible and accountable for the healthcare outcomes of that community. And one of the things that was interesting about Centra was it also had a health insurance company. And so it gave me a perspective to understand and learn that business while I was there. And it was a turnaround because it was the year before I got there, Centra had lost $25 million and struggled with an electronic health record implementation. That was a real challenge. The first year I was there, I arrived in May, we finished that year losing $36 million on $1 billion of revenue. The following year, we lost $147,000, and this past year, they made about $100 million on $1 billion of revenue. And we quickly turned that whole system around, and we quickly made big improvements in its quality and safety. And we're beginning to do the work really on culture that needed to be done. And I'm proud that we began to implement the first diversity, equity, and inclusion program ever in the history of that health system that really needed it very badly. And then I got the call about MaineHealth, and I got the call, I'd only been there, about a year, and I had had a frustrating meeting with another large institution in the community, and I just felt like, yeah, boy, it was just a difficult time. And so I think they caught me at the right time. I said, sure, throw my name in the hat. And I remember Courtney asked me, who's that you were talking to on the phone? I said, it's about this job in Maine. She's like, Maine?
Wait, what?
We're going to move to Maine? I said, no, Courtney, there's no way I'm going to get this job. Don't worry about it. And then I didn't hear anything for months, and COVID certainly, I think, impacted the search. And then all of a sudden got a call and said, can you do a Zoom interview? Yeah, I guess I can do a Zoom interview for this. So I did, and Courtney's like, how did it go? And I said, not good. There's no way I'm getting this job. And then a couple months later, can you do another Zoom interview? Well, sure, I'll do a Zoom interview. And got that call, got through with that. Courtney's like, what do you think? Yeah, I'm not getting this job. And then, can you come to Portland? And so we came to Portland in a nor'easter in December. And Courtney has always told me her whole life, if you want to impress me on a location, don't take me on a rainy day. That just ruins it for me. And so I remember going off to the little conference room where I was doing it. So they invited me to Portland so I could sit in a conference room at the hotel during COVID and do Zoom interviews with the board of directors. And so Courtney and my youngest daughter went out and saw the community. And I remember going down thinking, I don't even want to doing this. Courtney's never going to want to come here with the weather the way it is. And so I finished these Zoom interviews and I walked in the hotel room and Courtney's grinning ear to ear. And she's like, how did it go? And I said, I don't think I'm going to get this job. And then lo and behold, got the job. And I'll tell you, I've never agonized. I think this is probably the most agonizing decision ever, was to whether to leave Centra. We recruited an incredible team of leaders in. We're making such progress. Or the opportunity to come to MaineHealth. And what I saw at Centra was a lot of what I see at MaineHealth. A real opportunity to change the way we deliver health care, to get away from the crazy fee-for-service stuff that we do, to try to make it simpler and easier, and transition from healthcare not to health, but from healthcare to caring, and to really promote and support trusting relationships between patients and individual providers. That's not where healthcare is going, and it's not where it's going on a large scale. And we have an opportunity to do that, to protect it, and think about how we do that differently here, and do it on a much larger scale than I could have ever achieved at Centra. And despite all of that, I had decided on December 24th of 2020 to withdraw from the search. And I told Courtney that as I was leaving to go round at one of our hospitals that morning. And I decided, I was driving to that hospital, go rounding, and I was going to talk myself into calling the recruiter that day to tell her I was going to withdraw. And I came up to a stoplight, and I was frustrated because it was a really long stoplight. And I thought, well, at the very least, I can call the recruiter here. And I got to the stoplight, and there was this car in front of me that had about 15 Maine bumper stickers all over the back of it.
No, sir. It was Angus King's car, I think.
I kid you not, I took a picture of it. I still have it, and I didn't call the recruiter, and ultimately got the job, and ultimately decided this is the right role for me. And it was a hard decision. I felt that I was letting some people down, but I still see the potential and the promise that exists here to do something very special. And despite the challenges of the last year, I'm more optimistic than ever that we can all do something really special here differently about healthcare, and make it more affordable, make it a bit more personalized experience, and deliver better outcomes than anywhere else. The opportunity that exists, I believe, at MaineHealth is almost completely unique in our nation, and I don't want to see that go to waste.
Yeah, so what makes Maine so special? Like, why do you think this is achievable in Maine? And we're right there with you, by the way.
Well, because, so it starts with the people, for sure. And I think that there is a spirit of cooperation, of looking out for your neighbor, of wanting to do things that are important. There's tremendous pride in people who are from Maine, who have been here for a long time. And there's a real opportunity based on, I think, how MaineHealth has been constructed, which I give all the credit to my predecessors. We're large enough that I think we've got reasonable scale to survive into the future, and I think that's real. I think you're going to have a degree of scale that's effective in surviving the financial challenges that are ahead of all of us. And at the same time, we should be small enough to really be nimble and to be able to turn on a dime if we're smart about how we do things. We also are not fraught with irrational competition in not-for-profit healthcare, which I've seen really result in what I think is just really overinvestment and irrational spending in a way that doesn't make sense. We're not forced to do that here. And one of the things that I love, when I was asked in DC, picking up an award, feeling like an imposter for healthcare in Maine by Leapfrog for being the most safe state in the last decade, when people ask, why is Maine that way? It's because we all cooperate together. I have a great relationship with Tim Dentry at Northern Light. I have a great relationship with Steve Littleson at Central Maine. Great relationship with Chuck Hayes at Maine General. We all need each other. We all need to survive. I need them to be independent and strong if we're going to be successful. If something happens to any of them and they're not successful, it puts an inordinate difficult burden on us as a healthcare system when we're not going to be able to achieve our vision. That set of circumstances is really neat. I think we have a better opportunity to connect with employers in our region to actually figure out how we create something that makes sense for them, to where they feel like, yes, I've got to invest in the healthcare of my workforce, but you know what? I receive value for that. It's not just this expense that keeps growing year over year. I don't know how we do all that yet.
Yeah.
But that opportunity exists here, and I don't want to waste that. It's too precious. And so that's ultimately what led me here.
Well, we're happy to have you here.
I'm thrilled to be here.
So you walked into a number of things. In addition to the pandemic, you also walked into the nurses working to unionize,
Sure.
and now, of course, the Anthem situation. How does that challenge your leadership, and how do you lead through those situations?
Yeah, I mean, the reality is, I remember early in my leadership career, I had this epiphany, this thought. I thought, it feels like as a leader right now, dealing with lots of challenges, that I'm on a roller coaster. And I just wish that these hills wouldn't be so high and the loops wouldn't be so dramatic, and it would just sort of smooth out. And then I thought to myself, wasn't that stupid? I mean, this kind of is the job of leadership, right? If you don't like being on the roller coaster, then go back into clinic and be that way. So I also remember a scenario when I was leading the market in Charlotte, where I looked at the calendar a year ahead, and I think this goes back to Eisenhower's quote, that planning is priceless. Plans themselves are largely useless. And I remember thinking about the year ahead, and in July, we were going to have a joint commission survey. So this is our accrediting body that's going to come survey our hospital. It's a big deal. They do it every 3 years. And I remember when July hits, that's our flagship hospitals being surveyed. That's what's going to be important. And I remember thinking when July hit and somebody came into my office, the surveyors are here, the surveyors are here. And I'm like, get out of my office. I got like 20 other things that are way more important and more on fire than the surveyors being here. And so I think you have to just accept that as a leader, you're always going to be faced with a challenge you didn't see coming. Of all the things we had to do at Centra to turn that health system around, and all the priorities we laid, battling a pandemic never made the list. Mm-hmm. But yet we had to do both. And when that pandemic hit, one of the things we did early was one of my leaders said, the uncertainty this presents is overwhelming. I said, well, let's talk about it. How long do you think we're going to be in this circumstance? We're kind of paralyzed by this pandemic. And the answer that came, 3 years. That was 2 years ago. What's the impact going to be on it? Well, we're going to have economic uncertainty. It's going to strain the schools, which is going to put a huge stress on our work. We just sort of went down the list. But the biggest one we started with was COVID is not the only job to be done. We're going to have to do that, and we're going to have to turn our health system around. And we figured out how to do that. And so I think part of what we have to do when we're faced with challenges like this is really commit that we're going to do the work that needs to be done, prioritize what's important, and then really work together as a team to try to be as effective as we possibly can. And we won't always get it right. We certainly didn't get it right at Centra. I certainly haven't gotten it all right here in my first year at MaineHealth. But you can't really begin that journey unless you're really intentional about trying to build trust. And I think we've been working on that as a team at MaineHealth. We got a long way to go, but to me, that's really foundational to everything.
I think that flows nicely into what you told me about one of your communication strategies, which is open door.
Yeah.
With 22,000 plus employees, you have to make yourself accessible. You also have multiple locations.
You do.
So how do you stay connected to your employees?
Yeah, it's a big thing, and I think it's critically important. So when I got to MaineHealth, I told Terry Canan, our Chief Marketing and Communications Officer, I want to create a meeting in which everybody can connect to, in which we talk about all these issues, and I want to do it in this kind of format, and I want to do it like on Friday afternoons, and I want to do all this stuff. And as she typically does, in a very kind way that doesn't break my fragile ego, she says, let me work on something for you. And so she and her team came up with this amazing idea called Open Door. And so every 2 weeks, I get an opportunity to to do a live sort of broadcast to the organization over the internet. And we spend about 15 minutes talking about topics that are really important in the moment or for our organization. We talk about our values. We talk about diversity, equity, inclusion. We talk about how we think about caring for our patients. And we talk a lot about our vision of working together so our communities are the healthiest in America. Then we get to take questions for about 20 minutes. And one of our new executives joined the team. He's like, hey, what's this Open Door? And I said, it's a way that the organization can ask the CEO 1,000 different times, am I getting a pay raise? And so we take live questions for about 20 minutes or so, and I get some zingers. I get some real zingers, and sometimes I zing back with honest answers. We have to be authentic and real about what we are, what we can do, what we can accomplish. And then we always end with appreciation. So we celebrate some care team members or some people who've done amazing things and some of that other stuff. And we regularly get about 10%, 15% of the organization tuning in. I don't expect everyone to. And I tell people that. Sometimes people apologize when they mean, I'm so sorry. I don't expect them to do that. It's just another means of trying to build community as an organization as we've come together as a healthcare system. And the team, Terry's team is amazing, and they figured out how they can actually break the broadcast up into sections. And so we post that on the intranet. So if you just want to watch 5 minutes of me talking about one topic, you can do that. If you want to hear me getting grilled with a really tough question, you can just do that. And so I think we get a lot of positive feedback around that, but it's still not enough. So I am very intentional and largely disciplined around really scheduling 1 day a week to go around in our healthcare system.
Yep.
And I do it predominantly unannounced. I just show up somewhere and I just start talking to people and having them, watch them in action, see the conditions that they're working under. Sometimes it's sharing their pain with them. Sometimes it's celebrating a success with them. Sometimes it's hearing them talk about something they're really proud that they've accomplished. Sometimes it's helping me understand the challenges they face in caring for our patients. But just getting an opportunity for me to hear them, for me to thank them profoundly for what they do every day, and for me to just have an opportunity to listen. And we have really good meetings at MaineHealth, and they're super productive, but I learn more in that day of rounding than I do the rest of the week. I just simply do. Sometimes I do a job, and so this past fall, I worked as an environmental services worker at Maine Medical Center. So I was on my hands and knees scrubbing toilets, making beds, doing hard work, and talking to that care team member about what their life is like. And learning that one of them began working there when her son, who's got some physical and developmental disabilities, was cared for at the Barbara Bush Children's Hospital. And that experience so profoundly impacted her, she just wanted to be a part of that. And so she began working as an environmental services worker for us, while she also raises her daughter in addition to her son and is the primary caregiver for her husband who has advanced Parkinson's disease. And in those moments, you are just completely and utterly awed and humbled at what people do and how they live and what troubles they face and how they have this amazing positive attitude and look forward to doing what to me was literally back-breaking work. I was so sore that next day, and knowing that I could get up, take some Motrin, limp into the office, and she was getting up and doing that again. And it really gives you healthy perspective on what people go through, what their journey is like. And it gives them an opportunity to kind of poke me and see, okay, you're like a real person too. And, you can make fun of yourself and you can do things. You can at least take a little bit of time to say hi, thank you, and listen to what I have to say. It's so important. So we've been kind of building that capability as a leadership team. Increasingly, the team is out and about rounding. And I just got an email from our chief technology officer who said, I got to tell you, I was really resistant to this. But now that I've been about and really talked to he goes, I now see the value in this and how important it is. And so I've created a couple combos, which I think is important.
Wow, and so you really prioritize getting out there
it has to be. What could be more important than connecting with the organization you're leading?
Right.
I don't know how you could do that's how you learn the state of the mind of your organization and understand that. It doesn't fix everything.
Yeah.
It doesn't solve all problems. And there are some days I leave that rounding absolutely incredibly inspired. There are other days I leave that rounding just absolutely crushed at some of the decisions we've made and trying to figure out how we can be better next time. So I can't imagine doing the job without doing that.
A lot of Maine companies are dealing with staffing shortages and also staff burnout. And I think that you probably have those problems at the highest level. So we love to give people some little takeaways and tips on what to do. So those are really big issues that you're managing. How do you tackle it?
Yeah, Lisa, for sure. And our teams are exhausted. They're just exhausted, and they're really digging deep to keep doing what they're doing. And the harsh reality for all of us is the workforce stuff. This is going to be, I think, a dozen or more years. I just think we're in this for the long haul, and we've got to take care of those individuals. So we really are trying to prioritize them. I just think that while our patients are at the heart of what we do, and one of our values is patient-centered, if our team is not their best, they're not going to deliver for our patients. So we've got to make them our priority right now. So we're trying to do all the things that I think all of you all are trying to do, make sure they're paid fairly, trying to think about ways we can support them. And I think we've had to have a hard look in the mirror around what has worked and what are our expectations on how people achieve that. And I think we are finding that really understanding how we can be flexible, how we can challenge our own paradigms around what's important is going to be imperative for us. And the more flexibility we can give, the greater our likelihood of success is. Making sure that we're creating true engagement, and not necessarily by following the engagement survey instructions, but really by trying to connect with people, listen to what their concerns are, and giving them a voice in how we make decisions is going to be hugely important for us as an organization. And I think one of the big things that we're doing to think about how we prepare for our future is really around trying to change our mindset around how we think about the processes we engage with every day with our care team. Omar Hassan, who is our Vice President of Quality and Safety, or Chief of Quality and Safety at MaineHealth, who's a brilliant individual. And unfortunately, my time with Omar gets limited by our executive team, because when I was there early at the organization, I shared an observation that I think people realized was true, which was every time I engage with Omar, I feel like I gain 5 IQ points, but I feel like he loses 10. And so they limit my access to him because we really need him to stay super smart. But he talks about that we've got basic processes, taking a cake mix and baking a cake, complicated processes, putting a person on the moon, and complex processes, raising a child. And I think in healthcare, and I think in a lot of industries, we've been guilty of trying to take complicated problem solving to complex problems, and we can't think that way anymore. And that's why we've come to the conclusion that we can't just create efficiency by driving all the patients to Portland from our community hospitals. The pandemic has taught us we're not going to be effective that way. We've got to actually invest in creating greater capability in our community hospitals. It's good for the patients, it's better for care. Long term, it'll reduce the cost of care. And that's why we've got to think differently about how and go against the industry dogma on some of these things to do that. And I think if we do that, we've discovered that the higher acuity care we can provide safely in our communities, the more engaged our team gets. They feel better about the work they're doing. They want to do more. They want to take on more responsibility, and they want to keep patients in their community, which is important. And so I think that's one of the things we're doing. And then, of course, we're investing nearly $2 million this year on supplemental behavioral health support for our care team. We have to be willing, and one of the topics we've talked about in Open Door is trying to create an environment where we can talk openly about our own state of mind. Knowing that there have been times I've struggled with my own state of mind, even in the past year, trying to deal with all that we're dealing with, and that's okay. None of us are perfect or human. And having the vulnerability as leaders to address that and be engaged in that conversation. So we've partnered with Talkspace to give all of our care team and their families the opportunity to have virtual counseling in an unlimited fashion. And so we're hoping that a number are going to take advantage of that.
That's great. We are ready to open up to questions if folks want to go to the mic and ask Andy any zingers. Apparently, he's got a lot of experience with that.
So what you got to understand, in some ways it comes a little bit natural to me because, as I mentioned before, I've got a really opinionated wife and 3 daughters who've been raised in her image. So I get zingers all the time when I walk in the door at home. So, it comes with the territory.
Great. Oh, Susan. Susan Morris, great to see you. She's always got the first question and a good one, so let's go.
Wow. There's some pressure. Good morning.
Good morning.
And yes, let's just start big. I would be curious to hear your vision on addressing rural delivery of healthcare and also aging population.
Yeah.
Here's my thought. And by the way, I so applaud the Innovation Center. Amazing what is going on there. What's keeping me awake at night is I can see in 10, 20 years how through delivery of telehealth, et cetera, we're going to be in a different place. We'll be figuring out some of the issues of aging. I can't figure out in places like Maine, and we're not alone, what does the next 10 years look like? And given some of the things that you're mentioning, how do we get through the next 10 years with appropriately delivering healthcare in rural communities and also with our aging population?
Yeah, for sure. So I would not have taken the role at MaineHealth if there were not rural hospitals, because it's such a big, staggering problem that we've got to solve as an industry, as a nation. So it's important for sure. Our communities are counting on us. And our communities are counting on us for two different reasons. They're counting on us because individuals need good care in our rural communities. And I remember driving to Farmington and to our hospital there and seeing an ambulance pull up from a community that's a 2-hour ride away. And recognizing that those individuals take 2 hours just to get to Farmington and another 2 hours to get to Portland if they need advanced care. We've got to figure out how we can continue to deliver care to those communities. And so we're going to have to think about things differently for sure. I would have said before the pandemic, we don't have a cost structure that allows us to affordably provide hospital care for low acuity hospital patients. In the aftermath of the pandemic, I don't think we have a cost structure, and this is just industry-wide, not just MaineHealth. We don't have a cost structure that allows us to care for moderately complex patients in the hospital. So one of the things we've just talked about, in fact, this week as a leadership team, is we've got to challenge ourselves to figure out how we deliver care as close to where a patient lives, preferably in their home, and if not their home, in schools, places of worship, workplace, to really try to drive care outside of buildings we own or lease. We cannot construct our way to solve our healthcare problems. We just simply can't. So we're willing to talk to individuals and disruptors around how we think about things differently. Now, this will not affect the population you're talking about, but I'll just be so bold to say that we're talking with a significant disruptor about how maybe we take capitated risk on Maine care. How do we start to share risk with the state on helping reducing avoidable utilization? How do we provide more telehealth to keep people around and improve access at the same time? It is going to challenge a whole lot of our paradigms as physicians, as nurses, as healthcare professionals, but we don't have a choice. We have to do that. We're going to lose the vast majority, I fear, of our nursing homes, skilled nursing facilities. And so the thought that we can just discharge patients from the hospital and put them in another institution is not going to exist. So we've got to figure out how we start to expand our capabilities to provide routine care at home. Technology will help us with that, but we're going to have to develop the human talent that's capable of doing that. And I think we're going to need jobs that don't exist today. I think we're going to have to rethink how we do work in healthcare. And a lot of what individuals need in those circumstances, at times, yes, they're going to need intravenous medications that are mixed carefully. And yes, at times they're going to need careful physical exam and assessment. But a lot of times they just need somebody to reach out and talk to, and somebody who they know is there for them and has their best interest at heart. And I don't know that you necessarily have to go to medical school or nursing school to have that. And so how do we start to think about that workforce differently to expand our capabilities at far lower cost than we think today? I think those are where we're going to have to spend a lot of time, energy, and effort to shift the way we deliver care. And I should say the second thing that our communities are counting on us for, in most of the communities we serve, we're either the first or second largest employer. We provide jobs in those communities. If something happens to our rural communities, our ability to provide care and work in those rural communities, we create a crisis for some of those rural communities. And so that's not lost on us either.
So a related question that we got in advance from Brie O'Malley of City Year was, is there an innovation initiated by your staff that you're really proud of? And how did you support them in bringing it to fruition?
Oh my gosh, there's so many innovations that we have. We have an innovation center which does amazing work. And they're working on all kinds of crazy products that I think are actually going to be able to help us deliver care. I'm super proud of the work that Doug Sawyer, our interim chief medical officer, is working on around hospital at home and how do we start to deliver more care outside the walls of the hospital. It's early in its infancy, but that's a program I think we have to continue to support. He's doing it very organically, working with our physicians to come up with some things that seem natural and not coerced. And I'm really, really excited about that. I'm really excited about our partnership with Agilon, an organization that promises an opportunity to deliver better care for an elderly population with Medicare Advantage, and that actually creates financial incentives for us to keep patients out of the hospital, out of the emergency rooms, and to ultimately reduce the cost of care. That comes at the sacrifice of fee-for-service revenue that we get today, but that's okay because we need to start moving our business model to align with our vision of working together so our communities are the healthiest in America. But one of the things that's so cool about that partnership is they are hungry for research on how we provide better care to our senior population. And by the end of the year, Agilon expects to have nearly 500,000 members as part of their program. And so they're partnering now with our research institute on really helping us understand where are we doing well together in delivering care for seniors that can impact 500,000 seniors across the country and really beyond that in multiple states. So I'm super excited about the collaboration that I think can exist there as well.
So, members of the business community, we're all here. We're all in this with you. What can we do to support your efforts?
I think continuing to honestly give us feedback, engage with us. Let's have hard conversations about what's important for you, your workforce, how we can think about building a better healthcare delivery system for our future. As I'm not sure that I ascribe to the commonly held belief in business around shareholder supremacy. Having said that, I absolutely believe in it for me in my role, because our shareholders are all of you in the communities we serve, and it's my job to ensure we're creating value for all of you. Our vision is working together so our communities are the healthiest in America, and we talk a lot about what the word community means, that it's not just the geographic locations we serve, it's no matter how we identify ourselves. As an employee of X organization, as someone who's newly immigrated to the United States, as someone who identifies themselves as gay or lesbian, all of those are communities, and we owe it to all of them to ensure we're doing our very best. And then we talk about the word together and recognizing that our vision is so aspirational, we can't do it alone at MaineHealth. We have to have committed and effective partners in order for us to be able to achieve that. And that's where all of you come into play.
Well, thank you. And thank you all for being here today. Andy, we are so glad that you're here in Maine.
No, I'm glad to be here. I'm thrilled.
And congratulations on your one-year anniversary.
Yeah,
it was a tough one. I hope year two's a little easier.
This lifelong Southerner made it through a Maine winter, so I'm just like on top of the world.
You got it. All right. Well, happy Friday, everyone, and we will see you again soon.